Hello colleagues, greetings. eSkool always helping you to understand therapy in simple form, and I'm sure that this knowledge building your confidence too. I welcome you all for the next initiative of Uniforeva eSkool. This time we will going to see one of the important brand in our portfolio, that is Bizlo. As you all promoting Bizlo to targeted neurologist and psychiatrist. This module is totally dedicated to one of the key indication which is in our visual aid, that is spasticity. My name is Prabhakar Jha and I am from sales training team. Let's start our journey to the knowledge of spasticity. Spasticity, by its prevalence and incidence in world, approximately 12 million people are suffering from spasticity. 80% people with multiple sclerosis may have various degrees of spasticity. Around 80% of people, or especially the child, are those suffering from cerebral palsy may develop spasticity. 35% patient with stroke, 40% patient with spinal cord injury, and 50% patient with traumatic brain injury are suffering from spasticity. So you see spasticity such a major indication. Spasticity is derived from the Greek word that is spasmos. It simply means drawing or pulling. In simple terminology, what we call the stretch of muscle. And this stretching of muscles is a motor disorder, a velocity dependent that increase in tonic stretch reflexes. Moreover, these tonic stiffness or tightness of the muscle can interference with normal movement and speech, and moreover gait, the manner of walking. The various causes associated with spasticity, as we seen in the first slide, spasticity does not come single. So it is more common with patient with cerebral palsy. As we know, cerebral palsy is a physical disability that affect movement and posture, and it is more common in underdeveloped child, or what we call as a childhood physical disability disease. Multiple sclerosis is one of the main reason for spasticity in adult. Multiple sclerosis, a degenerative disease that attack the central nervous system. Apart from this, spinal cord injury, stroke, and traumatic brain injury is also a cause for spasticity. Infections like encephalitis and meningitis could be a reason where a person or a patient develop the symptom of spasticity. These symptoms include muscle tightness or stiffness, particularly in arm and feet, that are uncontrollable, increased muscle tone, deformity in bone and joint, abnormal posture, and overreactive reflexes are other symptoms of spasticity. If we put these symptoms in percentage wise prevalence, its abnormal posture, pain, or inability to sleep contributes to 34.5%. Stiffness and limited range of motion contributes to 42%, and limitation in activities of daily living contributes to 23.5%. And in this picture, you can clearly see how our body parts are affected with spasticity. Spasticity, by its pathophysiology, it is thought that spasticity may occur when there is a relative overexcitation of alpha motor neuron due to the absence of descending inhibitory signal. Imbalance between excitatory and inhibitory impulse to the alpha motor neuron in the spinal cord. In patients with cerebral disorder, this overexcitation may be due to lack of descending inhibitory input from the brain. In patients with spinal cord injury, this overexcitation may be due to the inability of inhibitory impulses reach alpha motor neuron. Common goal for the treatment of spasticity always include relieving the sign and symptoms of spasticity, improving patient normal movement, speech and gait, enabling the more and more muscle growth, that to be normal muscle growth, particularly in children, those who is suffering from spasticity, and reducing the pain and frequency of muscle contraction is major treatment goal for patient who is suffering from spasticity. In pharmacological management, baclofen, it is a time tested and trusted molecule having action on motor neuron level, which works on both excitatory and inhibitory neurotransmitter, and we will going to discuss this at a length in third module. And baclofen come under the class of anti-spastic agent, and there are other molecule also present to be used in spasticity management. So let us move and recap all our learning what we learned through this first module. Spasticity always associated with few common disease and disorder like multiple sclerosis, cerebral palsy, traumatic brain injury, spinal cord injury and stroke. It is a motor disorder which is related to muscle tone. Symptoms include muscle tightness, increased muscle tone and more common bone and joint deformities. Pathophysiology is talking about the imbalance between excitatory and inhibitory impulses. Treatment always targeted towards reducing the sign and symptoms and improving overall quality of life. And baclofen is a time-tested and trusted drug to treat spasticity. I hope this will help you to understand spasticity and other indication which we are mentioned in our visual aid communication. We will meet very soon in the next module, in which we are talking about the another important indication, that is alcohol use disorder. Till then, happy